Lower back pain refers to discomfort or pain felt in the area of the lumbar spine, which is the lower portion of the back, between the ribs and the pelvis. It is a common condition that can be caused by a variety of factors, including muscle strain, injury, or degenerative changes in the spine. The pain may range from mild to severe and can be acute or chronic in nature. Lower back pain can affect people of all ages and can significantly impact daily activities, such as work and exercise. It is important to seek medical attention if lower back pain persists or worsens over time. Lower back pain is a common health problem that affects people worldwide. According to the World Health Organization, lower back pain is a leading cause of disability worldwide. Studies show that up to 80% of adults experience lower back pain at some point in their lives. Lower back pain is more common in older adults, and those who are overweight or obese. It is also more prevalent in people who have a sedentary lifestyle, or perform jobs that require repetitive heavy lifting, or prolonged sitting or standing. Let's see the causes of lower back pain. The first one is muscle strain or ligament strain. The second one is disc herniation. And the third is spinal stenosis. Let's see all one by one. One of the most common causes of lower back pain is a strain of the muscles or ligaments in the lower back. This can occur due to sudden movement, lifting heavy objects improperly, or poor posture. The spinal discs in the lower back can become herniated, or bulge out of place, due to degenerative changes, injury, or wear and tear. Spinal stenosis is a condition where the spinal canal narrows, causing compression of the nerves in the lower back. This can lead to lower back pain, as well as pain or weakness in the legs. Certain medical conditions such as kidney stones, endometriosis, or tumors in the spine or pelvis can cause lower back pain. Lifestyle factors such as obesity, smoking, and poor posture can contribute to lower back pain by placing extra stress on the lower back. Psychological factors such as stress, anxiety, and depression can contribute to lower back pain by increasing muscle tension and causing changes in pain perception. The lower back, also known as the lumbar spine, is located below the ribcage and above the pelvis. It is made up of 5 vertebrae L1 to L5 and is supported by a complex network of muscles, ligaments, and joints. The vertebrae in the lower back are larger, and stronger than those in the upper back, or neck to support the weight of the upper body. Each vertebra is separated by a cushioning disc, which helps absorb shock and allows for movement. The spinal cord runs through the center of the vertebrae, and carries messages between the brain and the rest of the body. Nerves branch off from the spinal cord, and exit the spine through small openings between the vertebrae. These nerves provide sensation and control movement in the lower back, legs, and feet. The muscles of the lower back include the erector spinae, quadratus lumborum, and the transverse abdominis. These muscles work together to provide stability and movement in the lower back. Ligaments are strong, fibrous bands of tissue that connect bones to each other. In the lower back, ligaments connect the vertebrae, and provide stability to the spine. Joints in the lower back allow for movement and flexibility. The facet joints, located on the back of each vertebra, allow for twisting and bending of the spine. The sacroiliac joints, located at the base of the spine, connect the spine to the pelvis and allow for weight-bearing and walking. The intervertebral discs act as cushions, between the vertebrae and absorb shock during movement. They are composed of a tough outer layer, called the annulus fibrosus, and a gel-like center called the nucleus pulposus. Acute lower back pain is characterized by sudden onset, and typically lasts for a few days to a few weeks. It is usually caused by a strain or sprain of the muscles or ligaments in the lower back. Symptoms of acute lower back pain may include pain, stiffness, and limited range of motion. Acute lower back pain can be treated with rest, ice or heat therapy, over-the-counter pain relievers, and gentle stretching exercises. Chronic lower back pain is defined as pain that lasts for more than 3 months. It is usually caused by an underlying medical condition, such as arthritis or degenerative disc disease. Symptoms of chronic lower back pain may include pain, stiffness, and limited range of motion. Treatment for chronic lower back pain may include a combination of physical therapy, medication, and lifestyle changes such as weight loss, exercise, and improving posture.